first meet with a mom and I can physically put my fist through their abdomen, and we know what's on the other side, those are your internal organs. And after 3 weeks, to have that closed up. After pregnancy, to put things back together, and just like we had that expelling force to push that baby out, we can also use that breath to pull everything back up. But we're told to look pretty, to stand up straight, suck in our gut, right, and look a certain way. And as soon as we do that, that brings our breathing up here in our chest. These are the guys, the fellas that are like, I bent over, my back went out. I just slept wrong at night. I've just always had a chronically low back, soreness.
Yeah, just had a weak back.
Sexual dysfunction, impotence,
Sexual
rather than dealing with the problem. So women, we get the diapers, men, you get the pill. And this is why this is not just a woman only issue.
Hey everybody, welcome back to the Prime Podcast. I'm your host, Dr. Skip Wyss, and as always, I have my beautiful, lovely, and radiant co-host, Dr. Julie Wyss. How are you today in your pink?
I thought you were going to say red because I was scratching my neck.
No, radiant. You look
I'm good.
beautiful.
I'm
I
good.
love your jacket.
Thank you.
Fantastic. You look look like a schlup.
We kind of look like we could be Easter eggs.
Easter eggs are talking about boys and girls and pregnancy and all things wonderful here, right? Because we're coming at them live from Legacy Life Studios here, Legacy Life Media, and I love this studio. It's so awesome to be in here. Now today, Dr. Julie, the last couple podcasts we've been talking about birth and breast milk support and all things mama, and I still want to continue down that road. I think we really need to talk about mom support now, and the first thing is zippering everything.
I want to say pelvic floor. So this is also, we were talking ladies, but this is also beneficial for the spouse as well.
Dads come to me and say, "Hey, do you think I should do your wife's pregnant breathing work?" And I'm like, "Yeah, you should, because it's leading to a lot of your low back pain. Besides vertebral subluxation, which we are amazingly good at detecting and clearing." GI function, pelvic floor function is really a problem in men too. But let's talk about women. Dr. Julie, what are some of the first signs that women deal with pelvic floor functional issues? Is it just a pregnancy thing?
No, I strongly believe it's not a pregnancy thing. I think it's highlighted in the postpartum realm, and I think everybody has normalized it. Like our media is really good at normalizing that as a woman, just in general, even now, like I've seen it for some teens, that it's okay for you to pee your pants.
Well,
ladies,
that doesn't sound good.
It is never okay for you to be peeing your pants. It's not okay. It's common because we have pelvic floor dysfunction, we have pelvic floor weakness, but it's not okay.
Well, if peeing your pants was cool, consider me Miles Davis.
That's,
right? That's that little old grandma with medicine. But urination, pelvic, urinary incontinence, bedwetting, pant wetting, things like that, it's not okay. It's not normal to have. Women should not be dealing with incontinence. And a lot of the times, pregnancy seems to be what I would like to consider the tipping stone, where like that domino finally falls, and then all these other dominoes that have been there fall. But
they become highlighted.
They become highlighted. They become exacerbated, actually. And what then leads to pelvic floor dysfunction in women and in men then across the board, because it's not just a pregnancy thing.
We could go back to the developmental period, right? And so, well, I mean, we talked about, and the world just decided that because kids were not developing appropriately, that they just changed the scale rather than actually addressing the developmental failure of some of our kids.
So you're saying the American Academy of Pediatrics went and changed the milestone marker for crawling?
Yes.
They absolutely did. Those buggers, they absolutely did. And they went and said it's okay to crawl past 6 months to learn how to crawl. Crawling should be happening between 6 to 8 months That is the milestone, generational milestone, developmental milestone of children.
But even if you didn't know that, right? If these milestones have been set for ages, again, there it's a range. But if all of a sudden, like we're seeing in the world that we are sicker, that there's more challenged people and children, and learning difficulties is on the rise, and we can talk about neurosensory, ADHD, all of the different labels that our children get, they just make it simpler by changing that milestone date. Why don't we figure out, well, why are these children not meeting these milestones at the appropriate developmental stages?
Because it cuts down on questions from mom.
Right.
It cuts down on
don't ask questions.
It cuts down on the need for the pediatrician to understand neurological development in children. It cuts down on just the questions that people can't answer anymore because they've never delved into it. And the thing is that there's never a right answer for it unless you're involved in it nonstop, like pediatric chiropractors, really good occupational and physical therapists that we use in our group of collaborators to help children out, is understanding those models of development. So what you're saying is that if a child crawls inappropriately, that leads to them leading to pelvic floor and diastasis as they grow up.
And this is why this is not just a woman only issue.
Right.
It's highlighted more in women, but these are the guys, the fellows that are like, I bent over, my back went out, I just slept wrong at night, I've just always had a chronically low back, soreness,
I just had a weak back,
sexual dysfunction, impotence,
sexual
all of these things are attributed back to developmental stages as a child.
And I saw this the other day literally in a real advertisement. It said how millennials are preparing for sex, and it has this girl fixing her top with a big old push-up bra on, and and then it immediately cuts to a product for erectile dysfunction, and the way she's dressed, you should not be dealing with erectile dysfunction, and they just cut to it and act like it's perfectly fine.
So,
and these people, these men in these commercials are probably between the ages, they look like 25 to 30.
Right. So rather than dealing with the problem, so women, we get the diapers, men, you get the pill.
Yeah, we get a chewable.
Rather than dealing with the underlying cause, the developmental period that can be fixed, we're just going to throw something at it for a quick fix and solution.
More chemicals. And I mean, fortunately, I've never had to take anything for erectile dysfunction. I have no idea what that's like. I know what it's like to suffer from that, from antidepressant use when I was younger. But I also don't know what it's like to have to take medication to make that work. But I could only imagine the sensation and everything would be off. And I can tell you that men out there, when we're talking about this, guys, I'm 41, okay? I'm double the age of what this company is actually trying to talk to, which I find really interesting. But the fact is that they're normalizing this, guys. They're normalizing it, saying, you know what, in your 20s, it's okay to not be able to get or maintain an erection. This used to be something that they targeted men in their 60s for.
Absolutely.
Friggin' Bob Dole was talking about how he's a client using Viagra with Pfizer. So what I mean by this is that the generational gap is coming lower and lower, which is freaking alarming. And then
that's scary.
This change in testosterone in men too, and saying it's low T, it's low T. No, it's lack of exercise, lack of sleep, and lack of nutrition. That you're letting yourself slip and you're letting yourself become soft. And I'm saying it because it's the truth. Soft is the pun as well. But you're letting that happen. So understanding that, and then taking x-rays of these men, and I know I'm going on a tangent here, and this is becoming male driven. I apologize, but we're gonna get back to females. I see a lot of disc degeneration and breakdown in these young men's spine, and it's the same thing in men when they're in their 40s, 50s, and 60s. I'm seeing a lot of young 25, 28-year-olds coming in with backs that look like they're in their 60s.
That's happening. It should be a 60-year-old, or that's when the precedence is, but the younger and younger that it's happening.
And that's how it ties into all of this birth conversation and breastfeeding conversations that we've had over these last couple of weeks now, is the fact that a subluxation, a misalignment of the pelvis from mom being pregnant or during the birth process and baby coming out with that happening, it starts that cascade. And because birth has become very, very hands-on, medicalized, don't trust mom, let mom just lay there on
All
her
of a sudden,
back,
mom forgets what the body's supposed to
fill
do.
her full of drugs,
Yeah.
and then try to depend on usually a male OB to come in and tell you how to birth your baby. I should come as no surprise. I've never birthed a baby. So what makes me an expert in that? Like, it just really bothers me because I care so damn much.
But that's where this isn't just a pregnancy thing, right?
No.
So it is a birthing concern.
Neurodevelopmental.
It's how you develop in the womb, it's how you were born, it's how you're meeting those developmental milestones, boy or girl, as you are growing and developing.
Exactly. And I think that is where it all comes back to. So now, let's put this on the other foot. Now we've talked about men, and I went on my tangent about everything there because it's just frustrating. But now when we talk about young girls and young women, the first signs of fertility in a young woman is she gets her period.
Yes.
Usually between the ages of 10 to 12 years old, sometimes 14.
Sometimes
depends.
even earlier.
Which is not okay. 10 is actually really early. What are some of the steps and signs that moms can look for pelvic dysfunction in a young girl during their period?
Well, if they are ready, and this isn't like, how many moms have come in and said, well, I struggle with severe cramping, just it's so painful, I pass that on to my daughter. No, you passed your lifestyle on to your daughter.
Yep.
So if they are already having extremely PMS, extreme cramping, just like there's definitely imbalances that need to be addressed.
Well, those hormonal imbalances and regulating the hormones in the body is a massive thing that actually what we do helps, because we get the brain back into full communication with the body, which then helps to naturally help it balance its hormones on its own, because it'll do. But even more importantly is when young women have these issues going on, and 9 times out of 10, they're usually constipated as well. So that GI tract, the reproductive tract, everything is controlled by their low back. We see it in men, like I just went on a tangent about, with erectile dysfunction and low back problems. In women, we'll see it in PMS issues right away, right out the gate, when they're first getting their menstrual cycle.
I mean, we're gonna have some of the symptoms, right? Of like those are those triggers that let us know what's happening. But if you're really in tune with your body, you should be able to know which side, the right or the left, of what you're ovulating on each month. And like, I can talk to 30 and 40-year-olds and ask, well, do you know if you're ovulating? And clearly this isn't discussed either. Most women don't even know when they ovulate or if they ovulate. So already the foundational support, like if we're talking, teens and early 20s, and maybe we're not thinking about fertility, we're not thinking about starting a family, but if that foundation already is not understood and there's dysfunction and that's not under control, then that's why we get when we want to start a family, where the infertility comes into play.
Sure, yeah, and that can be on both sides. It's not just a woman issue either. And a lot, like we said before, a lot of pressure gets put on young women, and especially in childbearing years, of it's your fault. You're the reason why you can't have kids. You're the reason why your eggs are dried up and old, like all this crap. And it can come back on the man as well with fertility. It can come back on the man as well with morphology issues and swimming issues. But then here's the thing. That's almost pitying. Where they're like, oh, his sperm doesn't swim correct, or oh, he has motility issues, versus
let's fix it.
Or the other side of it is well, she can't have kids because she can't ovulate, versus a man where it's like, oh, poor baby, you're not producing testosterone, you're not producing estrogen, you're not producing progesterone, you're not producing the sex hormones that need to be there for proper production of sperm, and that's a serious issue as well. But we coddle men and we get mad at women. And that's not some egocentric thing here. That's just what has happened. So now, from a female's perspective, Dr. Julie, and you're working with these moms now. So they come in, they are pregnant, and is there room for pelvic floor work when they're pregnant? And what can they do before pregnancy?
So, let's just start at the basics. Okay, so our bodies are super smart. Our bodies are designed to heal themselves. Our bodies are built to be able to carry a baby.
Okay.
Okay. And you like mentioned a zipper when we first started here. So our bodies are super, super smart that we have these abdominal muscles, right? And if you're really fit, like you can kind of start, you can see that definition, right? And there's not an abdominal muscle that goes across, right? We kind of have a line at the front and then our abs are situated on each side of that.
Okay.
That's essentially where you have this nice little zipper.
Yeah.
So when we are growing that baby, 5 pounds, 15 pounds, whatever it is, again, our body is made to be able to support that baby.
Okay.
So that tissue is going to, it has the elastic stretch thing. I couldn't think of the word stretch. Your skin is going to stretch, but in that middle area, think of it like a zipper. That zipper is opening up to allow space for that baby, which is great. Some women are going to see that little line up their abdomen, that linea alba. So that is where that zipper is, right? So that's all fine and good, right? And then baby's born, right? So think about that zipper. That zipper opened up. Baby's born. All the attention goes to baby. Nobody talks about mom and reminding her that we need to zip that back up. So this is where understanding the support structures that we need to pressurize that system, and that's working with pelvic floor and diaphragm, and it's that whole centrical area that needs to be pressurized to bring the area back together. And so when this breath work can be implemented, and if you're pregnant, this is amazing. Like again, everything that we do is because we learned it secondhand or after the fact, that like, I don't know how many women go into birth and like if they've taken birthing classes, right? It's like to push the bear down. You don't quite understand what the heck that means. Am I going to poop on the table? Like what's actually happening? But if we can actually like think with me here, if we can pressurize this entire system and we have coordinated breath that's going to work with each contraction that we have, how much easier it is to actually birth a baby. So much easier because everything then is working together. You're not pushing and then a contraction and maybe only one side of the muscles internally are actually working and firing. And it's amazing to know that, like, just with proper breath work that can do that. So it can empower you, if you're thinking of becoming pregnant, while you're pregnant, but then in that same breath, after pregnancy, to put things back together. And just like we had that expelling force to push that baby out, we can also use that breath to pull everything back up.
So I can hear moms right now being like, okay, like Dr. Julie, she's talking about this. Has she really been through it? Does she understand it? I can tell you right now, this woman has suffered an umbilical hernia, ended up having it surgically repaired, and then realized after that, a few years down the road, that
worst decision ever.
Could have all been prevented, right?
Yep.
With proper pelvic and core work. And we're not talking sit-ups. We're not talking...
No sit-ups, no planks, no Kegels. Because again, if you're not pressurized right. So again, if we think about that zipper postpartum, right? That's how that zipper is open. Do you know what's on the other side of your belly button? Those are your intestines.
Yeah.
Right? And so we need that zipper to close to have that support. And when that's not closed, umbilical hernias, and then we feel like we're falling out, that we should never feel like we're falling out.
What is the common feeling for a woman that has pelvic floor imbalance when she goes to lift stuff up? Where, like, a lot of moms don't even know they have it. So what is a feeling that they can look
So this is like when you're bending over, you're picking, and it doesn't have to be anything like heavy. Like this is where you can have that bladder leakage, or like you just always feel like this heaviness. Okay. You go to the bathroom, you sit down on the toilet, and all of a sudden you're emptying your bladder, but it's just like, is it all empty? Okay. Is there something coming out? And like I've literally had women like, I was gonna say, like it literally is hanging out. And I would think 80% of the population is walking around postpartum with a prolapsed uterus, right? How many women at 6 weeks, you go in for that checkup? Some of the OBs don't even do an internal exam because you come in, you're maybe still self-conscious, right? It was fine to bear all when we were pregnant, but you come in and then well, how you doing? Well, I'm doing great. Like they don't even like really check for postpartum depression because that's right where that's starting to trigger. I feel like they're trying to get you at 6 months before you're falling apart. But if they're not doing an internal exam, or if it's super quick, you would just say everything's cool, you're leaving and not even knowing that like you're not functioning properly.
Yeah, and I think the other feeling that you commonly tell me is that when you go to pick stuff up, you should feel tightness like you felt when you were before you had baby in your abdominal wall in the front, like engaging to pick up and not through your pelvic floor. And that is a common sign that I end up asking moms a lot about, especially 6 months, a year out of their pregnancies, and they're dealing with really bad low back pain, instability, lots of pain. Like in women with low back pain, not talked about a lot, even though it's very common and doesn't make it normal, very common. And because men are notorious for low back pain. So are women. They just don't say shit because they're dealing with everything else in their life.
We don't have time for that.
Yeah, you don't have time for low back pain. And it's debilitating. But when I talk to them about it, the first question I ask them is, when you pick up something heavy, and I don't mean to be sexist, but like when you pick up a load of laundry, which is very commonly picked up by women, where do you feel the pressure when it's heavy? Or when you go to pick up your baby that's 20 pounds now because they're almost a year old, or depending on how much they've gained weight, some of them are 25 pounds at 6 months. Where do you feel the pressure? And the most common answer I get is like down through my like through my vagina, through my butt. And it's like, okay, that pressure actually shouldn't be there.
Scary.
That pressure needs to be here. Do you remember when you were younger and you picked stuff up and you never felt anything in your pelvic floor? Yeah, that's what it should still feel.
This is, so postpartum or even before, like painful sex, right? Like that's where,
that's horrible.
like there's so many intricacies that just get written off of, well, here's some lubricant. There's so many things that are happening within these scenarios. And like as women, right, maybe the culture is changing a little bit, but we're told to look pretty, to stand up straight, suck in our gut, right, and look a certain way. And as soon as we do that, that brings our breathing up here in our chest.
Okay.
And we don't need to support our chest. We need the support down here. This is why we have all the muscles in our abdomen. And so if we can just stop breathing up here in our chest and actually like be super confident in our bodies and breathe into our bellies, which is going to make them look bigger, right? But if we would all just do it, and if we can breathe into that area, that's where we're going to be able to start to pressurize this system. And then it's like magic. That low back pain just goes away. But again, you have to be cued into breathing just within the pelvic floor and diaphragm, because if you aren't pressurizing that system, that's where you're going to be breathing, and then you're going to feel that pressure going down and out.
Taking care of the moms that I do take care of that have been through a prenatal class with you, or postnatal, that have been through a pelvic floor class with you, a few months out, their low back pain will start to come back. And my first question to them is, hey, have you been doing your breathing exercises? The number one thing I get back though is, no, I haven't. I forget to. And I was like, so do you feel different when you do them? Yeah, I know that I need to do them again because my back's starting to get tight or it's getting weak. So again, this is a form of exercise. It's a form of therapy. You don't just go to the gym and do 2 sets of curls.
This is a muscle. This is a muscle. And so when you do it, you become strong, and then it supports your body. When you don't do it, the muscles get loose. They forget what they're doing. They don't support you, and then you have your concerns. You have those issues.
I will tell you that I can always tell when you're doing your work. When you have your classes going, your breathing classes going, I can tell it with you.
I'm just like all the rest of you. I forget as well. I am not perfect.
In multiple areas. And it's a great thing to have control for women to actually, and men to have control over these organs. A lot of this comes back to, and you hit on it, painful intercourse. And most people will then turn around and say, well, your hormones are off. Your estrogen's off, or your progesterone's off.
It could be, but there's multiple things.
There's multiple faceted things going on here. And I know for a fact that they can get help from you and other people out there. And just because you've had pelvic floor work done maybe in the past, have you revisited it? When was the last time you did your breathing exercises? When was the last time somebody talked to you about actually breathing properly versus doing planks, sit-ups, leg raises, all these things to build your abs up versus support and strengthen?
And let me just say, like, there is tons of pelvic floor therapists.
Yep.
But there's, again, you have to find the right one that truly understands what is going on, right? Because there's some that just decided to go down that path and doesn't understand the intricacies of it, and sometimes can do more harm than good. I feel terrible saying that, but like I've seen it happen multiple times. So it's making sure to find the right ones with the right credentials that know, maybe if it's postpartum, if it's even before that, just that you're doing the right work.
You're starting to see pelvic floor centers pop up now. It's starting to become more and more aware to women that this is a definite issue. Men, it's this issue too. All we have to do, though, is we need to support our moms and support our pregnancies, both pre and post. And how do we help them all out? That's the key. So getting a hold of Dr. Julie is actually fairly easy. You can either call the office, go to primefamilycenters.com and book an online appointment with her, and she can get on the phone with you and talk about all of this and give you a solution and hope.
Resources.
Call the office, send you an email, drjulie@primefamilycenters.com. Like, you can email me too. I'll just connect you with this beautiful, amazing lady. She's my wife. I love her. I love her more than anything on this earth. And to see the health that she has now versus what she had right after we had Brecken, it's substantially different. And yeah, that was 12 years ago. So it's just been great.
But again, if we keep changing developmental
keep moving those
dates,
just kick
right?
the can down
So then we're going to be like, though, there's going to have to be more resources and more things set up to be able to pick up the pieces when they should have been taken care of as a child in those infancy stages, and then revisit it again throughout our age.
Heck yeah, I'm down. I'm going to take a class with you again. Probably should, right?
4 classes. Some gentlemen don't want to be associated with it. So like, that's where we do a one-on-one, but I can do a men's class.
Yeah.
It's empowering to be within a class session with a group of women and to see the changes when I can first meet with a mom and I can physically put my fist through their abdomen, and we know what's on the other side. Those are your internal organs. And after 3 weeks to have that closed up, just the empowerment for that mom, just the things that are going to be changing for her and for her future is just tremendous.
With that, I'm Dr. Skip Wyss. I'm with the fabulous Dr. Julie Wyss. I hope you absolutely loved this week's podcast, coming at you from Legacy Life Media Studios, and we'll be here for you next week. Anything else, Dr. Julie?
Nope.
All right. Take care, everybody. Go out there. Get it done. Bye.